I'm going to be answering a question from our study club. So yeah, I'd love to hear from you guys too. You guys have any questions that are similar or any offshoots? Happy to answer any of your questions. We basically have this study club where we try to support any issues that come up with with them on their implant placing journey. But anyway, so getting on to the question. So let me show you some pictures from this post. So basically what we have here is an implant that was placed. It was placed just a little bit deep. It's pretty popular, pretty common now to place your implants subcrestal. So this implant was placed subcrestal and it healed up, and then we have some bone growth right here, right at the collar, right at the neck of the implant. And so one thing that happens when you have bone around that collar and a little bit overgrowth is you start having a situation where your healing abutment is like butting up against your bone, and it causes a little bit of pressure. It's great that you have bone overgrowth, but it sucks that your healing abutment is putting pressure on it, right? Sometimes your things might not seat fully because of the bone there. So this bone situation is sort of a nuisance. This is the healing abutment. The specific question is, how do I avoid pressure on the crest of the bone in a case like this? So there's basically two things that you can do. One thing is you can do a flap, you can use a round burr and adjust really carefully. Put your healing abutment on put your cover screw on the implant before you do that, right? Put your cover screw on, do a flap, and then you're going to just use your round burr and relieve around the platform. That's pretty tricky to do, and it's very, very technique sensitive. You want to have your wits about you while you're doing that because you don't want your hand to slip. Another thing, I guess there's three options. Another thing is a countersinking tool. Sometimes there's like countersink tools that you can use to ream some of that bone out. The third option that I really like, because it's really easy to do and it's a little bit foolproof, is just using one of these guys. So let me show you right now how that can be handled. Let me go ahead and bring up the model and show you guys properly. There you go, boom. You know what? You don't really need the picture there, so let me bring that up. There we go. All right, so we got the model right here. So if you look really carefully on that model, you'll see that there's the bone level is real high. So let's get some more light there. All right, can everybody see the bone level there? Let's see. Yeah, the bone level with that guy is a little bit, the implant is submerged. Let me just pop that guy off the table. There we go. So you see that the implant is submerged past the crest of the ridge. It's submerged deep there. So if we try to seat our abutments, if we're trying to seat our abutment on there, if we're trying to take an impression on there, if we're trying to do anything on there, that's going to be binding onto the walls, onto the bone, right? And so that's going to create a problem. Your stuff's not going to seat properly, and when it doesn't seat properly, then that's when you get screw loosenings. That's when that's when you're going to have some issues. So let's go ahead and address this now. Yes, it is a pain in the butt because you do have to flap and do stuff. A lot of people are scared to take that extra step and tell their patient, oh, hey, you know what? We have to numb you up and do a flap again. But it's better to do it now. It's better to get that out of the way, and it won't be a problem later. So go ahead and deal with this now and not wait. So I'll show you how I do it. The simplest way really is just to take a blade. So let's go ahead and do that. So we're going to take a little blade, a super sharp blade. So if you get a brand new one, let's see, if you get a brand new blade, you can just trim the sides of that bone, and that just kind of flakes off. Can you see that? So that just kind of flakes off, and you want to hold it carefully, but can you see how that just comes off? Are you able to see that? So that's a really nice way that you can do it that is low risk to your implant. It's very careful and it's very intentional. And your burr is not going to be jumping around, right? Okay, you see what's happening in there? Let's see. Some bone pieces are getting into my implant. And so, yeah, you definitely don't want that to happen. So put a cover screw on there if you're going to do this. So put a cover screw on. It'll protect your platform and it'll keep bone from getting in there. There we go. Alright, so now let's just use this little, there we go. Boom. That's a really easy way to do it. If you want to, it's a really easy way to do it if you want to get rid of that bone that's impinging right there in the platform. Definitely bust out a blade and just trim it off nice and neat. The other way to do it, I'll just show you right now, is just to use this burr right here. This burr, it'll take care of it nice and easily too, but you do want to make sure to put something on there. So let's just do it right now anyway. Let me get my cover screw. Cover screws on the top of this guy on the little thumb grip. Alright, so I got my cover screw. And put my cover screw on. Alright, now that I got my cover screw on, I can go ahead and use that round gold burr. When would you choose one over the other? Both are just as easy, to be honest. If I can do it with a blade, I will. If it's not very much, I'll just do it with a blade. If there's more to cut away, I'll use a burr. So I'll show you what that looks like. I'm going to turn the water off for now, just because I don't want to make a big mess and not let you see what I'm up to. Dang it. There we go. So that's pretty much it. That's pretty much it. Those are the two ways that I'd recommend doing it. You just, you got two things in your tool belt. Feel free to use any of those just to relieve some of that bone around your implant. Remember, you never want to ignore these things. You want to just deal with it when you see it, and then that way you don't have problems later on. All right, that's pretty much it. Just wanted to jump in here and answer that question. If you guys have other questions, shoot me a DM. We do handle these in our private study club. So if you're in our study club and you ask me questions, I try to give you as thorough of a response as possible. Otherwise, I do try to hit up my DMs, but sometimes they slip through the cracks just because I get so many questions. I can't answer everybody's questions. But thanks, guys. Enjoy your lunch. See you later. Oh wait, somebody's got a question? No? Oh, somebody just said bye. All right. See you guys.